So the performance of DBMs includes osteoinductivity and osteoconductivity. What's particularly valuable about bringing DBMs to the surgical site is the introduction of proteins and the osteoinductive capacity of the DBMs, but equally important is the osteoconductivity of DBMs. And different preparations and different compositions of DBMs results in different osteoconductive properties. And specifically, fiber-based DBMs seem to have significant osteoconductivity that's better than the particle-based DBMs. This has been compared directly in work that Martin published in Spine back in 1999. And in that work, he was able to extract the proteins of DBMs and compare directly fiber-based DBMs to particle-based DBMs. In that study, the fiber-based DBMs performed better than the particle-based DBMs, even in the absence of the growth factors and proteins that are involved in osteoinductivity. So the conclusion then was that fiber-based DBMs have the capacity for osteoconductivity, and that's part of the property that I'm trying to bring with DBMs to the surgical site. So at this point, my preference in general is the fiber-based DBMs over the particulate DBMs.